See, the scapula, it doesn't move straight forward and back because it goes along the rib cage.
So it just
It
does.
moves in the plane of the scapula. So you can talk about scapular protraction and retraction, but it's sort of moving around the rib. It's a little more complicated movement like that. And then you have upward and downward rotation. We talk about the scapula and the glenoid fossa, where this would be upward rotation, downward rotation. But we'll get into that more when we talk about the scapula. There's some pictures of that in the trail guide book. And then, you have also, like with the ribs, you can talk about elevation and depression, like inhaling, would be elevation, you're moving your ribs up, and then depression. So again, here's the supination pronation. And then although you see it happening here, it's actually occurring here, right? And that's at the radial humeral joint. Whereas you have the supination pronation here, and you have flexion extension at the ulnar humeral joint. And then again, here's inversion and eversion. Protraction and retraction of the mandible. Elevation and depression of the mandible. And opposition. Now, I think like what we mentioned before when we were talking about palpation of the temporomandibular joint, it's a little more complicated than just elevation and depression because you have the condyle that sits in the esophagus, and then as you open it, it actually slides out and goes onto another articular surface. That's like when you feel your process of the mandible here, it kind of comes forward. You have a little bit of movement like this. You open your jaw, it actually slides out from underneath that, and then comes a little bit farther forward. Okay, do you have any questions? So the stuff that I've gone over at this point is what's going to be on the quiz. What I'm going to do is, if we have some extra time, I'm going to pull up another PowerPoint thing and talk a little bit about muscle. So, like I said, this is just going ahead a little bit. You don't have to worry about knowing this for the quiz for next week, but maybe on the one following. So, after this, we're going to start getting into muscle. First, we'll talk about muscle physiology, like all the minute details like we did with the bone. And then once we do that, then we'll be into different joints, talking about all the joints, the muscles, the actions, and things like that. And when you're talking about muscles, there's different ways that they're named. Right? So the more that, because you're going to have to do a lot of memorizing of muscles, right? Origin insertions and things like that. At least with muscles, the name of it is going to tell you something about either different aspects of it, like the location. Okay? Temporalis, where's that at? Well, it's going to be near the temple. Right? Intercostal, that tells you it's between the ribs. So then also there'll be things based on the shape of the muscle. Okay? Trapezius. Deltoid. Right? And then if there's some muscles that are similar but one's larger than the other, then you're going to have maximus, minimus, things like that. Longus, brevis. So some of the names are going to have to do with the length of the muscle. And then the direction of the fibers. Okay? You have vastus medialis obliquus. Or you have rectus femoris, rectus meaning straight, as in the rect. And then also there'll be how many origins that the muscle have. Okay? Biceps, how many origins is that going to have? Two. Triceps, that's going to have 3. quadriceps. And then also, sometimes muscles are named by their attachments. Usually the origin is going to be named first and then the insertion. Okay? Sternocleidomastoid. Because usually the insertion moves towards the origin. And then also there's going to be the action of the muscle. It's going to probably be part of its name. Flexor, digitorum longus, extensor, such and such. So a lot of times there's going to be combinations of the naming of the muscle. Flexor, digitorum longus.
Are these slides in the book here?
No. What I can do is make a handout of this, maybe have it for next time. Actually, they're in the book. Yeah, they're based out of the book. Are they in there?
Page 48.
In the notes?
5.172.
Yeah. Okay, so it is in there.
Page 48.
Can you say that again, you said?
48.
517.3. Yeah, all right, so that's right. So then, also based on their relative position, so if it's in medial or lateral or superficial or deep, external, internal, you have external intercostals, internal intercostals, rectus abdominis. So then here's some of the different muscle belly shapes. And that's not in the notes, but it's in this trail guide book. So basically, you have muscles that start out with a larger origin and converge onto a smaller version, like the latissimus. Latissimus originates all through into here and inserts on a small area on the humerus. And then biceps, like I mentioned, it has two different origins. Fusiform muscle, it's narrow on either end and wider in the middle, like the biceps or a lot of different muscles. And then unipennate has to do like with a feather. You know, the feather has the central and then the sides come out. A feather would be more like bipennate, whereas this would be unipennate where it's coming out on one side. And then there's a bipennate muscle. And then a multi-belly muscle, as in the rectus abdominis. So again, like I mentioned, a lot of times you're going to have combined methods of naming the muscle. Abductor longus, levator scapula, extensor digitorum fundus, tibialis anterior. And then sometimes muscles that are going to be similar, they'll have the same first name, middle name, but then the last name will be different. Flexor carporadialis longus, flexor carporadialis brevis, gluteus maximus, gluteus medius, gluteus minimus. So the more that you can try to get into some of the Latin names and try to understand what these muscle names mean, it's going to help you to memorize some of the muscles. And then you can have muscles that the fibers are parallel, and like I mentioned, fusiform or pennate, convergent. Circular muscles, like some of the muscles on the face, orbicularis oculi, and then around the mouth. We're not going to be getting into too much of all the named facial muscles, but you can understand some muscles are going to be circular. So there'll be circular around the mouth or around the eyes. There's a deltoid, which is multipennate. A couple other examples. All right.